Turning now to tonight's medical rounds. Chances are you or someone you know suffers from nerve pain. But what if we told you there was a way to reprogram that pain? Doctors at Hartford Hospital are doing just that by using a unique therapy that utilizes nerve pathways. And joining us live now to talk more about this fascinating treatment is Dr. Ricardo Taboada at the Hartford Hospital Pain Treatment Center. Good evening, Dr. Taboada.
Good evening. How are you today?
I'm well, and I hope you're well, too. We understand this procedure is called Scrambler Therapy. That's interesting. How does that work?
Essentially what this machine does, or this type of therapy, is normally when the nerves send a signal to the brain, it's a normal processing signal. What happens in people that have nerve pain is you get an abnormal signal. So what this machine does is it actually tries to retrain the brain as to what the normal signal should be.
Well, I'm going to ask the question next, and I know people watching this right now who have nerve pain want me to ask, which types of conditions can you use this to effectively treat that pain?
This machine works mostly for what we call neuropathic pain, which means a type of nerve pain. So diabetic peripheral neuropathy, post-herpetic neuralgia, complex regional pain syndrome, and one that it works extremely well for is chemotherapy-induced peripheral neuropathy. But essentially any type of nerve injury-related pain can benefit from this actual therapy.
That's fantastic. And how does it work? Is it a one-time treatment, or do you have to go back for a series of treatments?
It is actually a series of treatments. Typically within the first few visits we're going to know if the patient's going to be a responder, and if they are a responder then we have them come back for a complete series, which is 10 treatments.
And one last quick question, Dr. Taboada. Is there any downtime to the treatment?
So typically they come in every day for 10 consecutive days, and they'll be there for 45 to 60 minutes. After the 10 treatments, we will have some downtime, and we'll see how long the treatment lasts, and they may need to come back periodically for booster therapy.
All right, but it's good to know for anyone suffering nerve pain that there is a new form of relief out there, and we thank you so much, Dr. Taboada, from the Hartford Hospital Pain Treatment Center.